I want to hear you say it. That is labor progress. Dilation is not the be-all, end-all. Hello everybody and welcome back to my channel. My name is Elizabeth, also known as Nurse Sabe, here on YouTube, Instagram, and TikTok. Today I am coming at you guys with a video all about 10 ways that we can know that your labor is progressing. There are a lot of context clues that I personally look for as a labor nurse to say, I think things are changing. So let's go ahead and jump into it. And if you haven't heard of one of these things, make sure you let me know in the comments down below. Or if there was anything else that happened to you in your labor that let you know that things were progressing and ramping up to the birth of your baby. Labor is when we are having consistent contractions. Our uterus muscle is contracting to push baby down, to pull the cervix up, like your baby is putting on a turtleneck sweater. When you go into labor and delivery, or maybe at the end of your pregnancy in the office, or at some point, your provider will offer to do a cervical exam. And so with a cervical exam, there's a lot of information that we're gathering. People get really focused on dilation. And for me, as a labor nurse, dilation is important. Right? We need your cervix to go completely away so that it's time for you to then push out your baby. There's a lot of other things that we can tell from that cervical exam besides dilation that let us know that labor is progressing. Let's chat about all of those things, and then we'll have even more signs that labor is progressing without checking your cervix, because we don't want to be checking the cervix all the time in labor. One, it is invasive, it might be uncomfortable. Two, it is subjective, so you don't want to be checking it constantly with different people because they might be getting different numbers. But then also, and most importantly, checking your cervix repeatedly puts you at a risk for accidentally breaking the bag of water, or if the bag of water is already broken, puts you at a risk for increased infection. So our goal is to vastly limit the number of cervical exams unless they are going to change what we're doing. When your provider is checking your cervix, they will insert 2 sterilely gloved fingers into your vagina while you're lying flat on your back. They'll reach to the back and kind of feel where in your vagina is your cervix. Say what? So your cervix has a job. It has 2 jobs. During pregnancy, its job is to keep you pregnant. So it takes that little cervix self and it tucks it way back up, super posterior in the vagina, to keep you safe and to keep you pregnant. As labor starts and is progressing, that cervix is going to move into a mid position and then even anteriorly. So as labor progresses, those cervical exams hopefully should get less uncomfortable because that cervix has moved forward and it's much easier for your provider to find. So we might not have seen much cervical change yet, but that cervix has moved forward. That is labor progress. The next thing that they might glean is how open is your cervix, right? That's dilation, 0 to 10 centimeters dilated. But the next thing that they might glean is effacement, or how thin is your cervix. So a lot of times in early labor, we spend a lot of early labor thinning out the cervix. I have a little visual for you guys that I actually recently saw on Instagram. If we have a super thick cervix and baby's pushing down on it, right? We've got some thickness, we've got 3 hair ties here, and it's trying to stretch. It's really hard to stretch. So by your body working to thin out your cervix, and now it's 100% thinned out, as thin as a sheet of paper, look how much easier is it for it to stretch open. And that's why often that early part of labor is spent thinning out your cervix. So effacement is going to be one thing that they're feeling. The other thing that I argue is maybe the most important part of a cervical check is noticing where in the pelvis your baby is. Have they come down in their station? Have they engaged in the pelvis? Are they working on getting through the mid-pelvis or the outlet? Or are they still at the inlet? Those pieces of information really help us to glean what positions are going to work best to open up specific parts of your pelvis. So positions that open up the top part of your pelvis or move and make this area bigger are going to be different than positions that open up this really tight part of your pelvis where the mid-pelvis is in that ischial spine. Asymmetrical positions are going to open that up best. And that's going to be different too than what opens up our outlet. So we're going to be changing your positions or encouraging you to find position changes that feel good and right for you, because your body knows how you should move if you don't have an epidural based on where your baby is in your pelvis. The other thing that we can glean both from modified Leopold, which is where we feel the belly to kind of feel where your baby's back is, and also through a cervical exam, if your water's broken and you're about 4 centimeters, is what position your baby is in based on where your baby is in your pelvis, and also what position they are in, right? Are they coming down OT, which is often how we enter the pelvis? Are they in an OP position, which is something that can take a little bit more work for baby to kind of work through? Or are they in an OA position? Is their chin flexed? So how we can glean this from a cervical exam is by feeling your baby's soft spots on their head and by feeling their sutures. And that is like a little roadmap. So when we check your cervix, we can feel the top of your baby's head. And this is kind of a weird, random, cool fact, but if your baby has a lot of hair, particularly if it's got like really, really curly hair, I can feel that when I check your cervix, which is so cool and kind of encouraging, right? Like how close your baby is to the outside world. Kind of mind-blowing, but also kind of amazing. So those are all things that can be gleaned through a cervical exam. And if there is a change in any of those things, that is labor progress. I want to hear you say it. That is labor progress. Dilation is not the be-all, end-all. All of these pieces work together. If your baby is rotating, if your baby is coming down, if your baby is thinning out your cervix, your baby is then going to open the cervix, because that's what that cervix is meant to do. All those other pieces need to be in play for that cervix to open. So those are all ways that we can measure labor progress. But let's talk about some things that you might see or feel that can tell you that labor is progressing. So what is labor? Contractions and cervical change. So if you have contractions that are getting longer, stronger, and closer together, that is a really good sign that labor is progressing. And we talk about that 5-1-1 rule, which is a time when you're contracting every 5 minutes, lasting a minute, that's been going on for about an hour, when it's a great idea to call your provider and just touch base. But we can have a 5-1-1 labor in early labor. We can have a 5-1-1 labor in active labor. And so how do we differentiate if we're still in that early phase of labor, which can be pretty intense, versus we've moved to the active phase of labor? One way to know that your labor is potentially progressing is how are you feeling during the contraction, but also, and maybe more importantly, how are you feeling in between? So in early labor, you might have contractions that are strong and close together that you are breathing and working through, but in between, you can go back to your conversation, go back to watching your show. You're still kind of outwardly present. As we move into active labor, a lot of people become more internally present, seeking solitude and quietness in between the contractions as well as during them. So they might keep their eyes closed for the entire time in between the contraction. They might continue their breathing even in between the contractions. And that can be a great sign that you are progressing from that earlier phase of labor to a more active phase of labor. Another thing that you might notice as things become even more active is we talk a lot about changing positions in labor, right? Every 30 minutes, finding a new position and alternating between a restful position and a position that is more upright and moving. Eventually, those restful positions are gonna be a no-go. You are gonna be feeling like, I gotta be upright and moving the whole time. I cannot find a restful position that works well for me. And that can be a sign that baby's getting lower and things are progressing. Another sign that baby might be getting lower in your pelvis is that your movement change. So a lot of times when we're trying to get baby in the inlet, you want to kind of picture, right? We have like this basketball hoop and a little basketball that we're trying to get in. So we might be going back and forth like this to find the perfect room for baby to get in. As baby gets into the pelvis and they're rotating and flexing their chins, side to side positions that give that asymmetrical movement to create more room in the mid pelvis might be what we gravitate more towards. I noticed particularly in my labor, when I first started off, I would have to get on hands and knees and rock back and forth for the contraction. As that baby got lower, I felt moving side to side worked better for me. So that can be another clue that we're having some labor progress if what feels good and right for you with those movements changes, because your baby is getting lower in your pelvis and your baby is telling you exactly how to move. If you can can tap into listening to that and relaxing through, you are gonna be golden. Another sign that we are seeing some labor progress and hopefully some cervical change is bloody show. So a lot of times bloody show will almost look like, and this is a gross descriptor, but I feel like it's really, really true. You know, if you've been like really, really sick with a cold and maybe you had like a little bit of a nosebleed and you blow your nose and there's like a whole bunch of mucus mixed in with some blood, that's what bloody show can look like. It also can look like a little bit of frank red bleeding, very, very small amount. If we're getting anywhere near close to filling up a pad, you definitely need to talk to your provider, call them into your room, or call them from home if you're at home and head in, right? Because we don't want to have too much bleeding. But the cervix is super, super, super vascular. So as baby's coming down on that cervix and that cervix is stretching, a lot of times we see a little bit of bleeding. And that can be a really good hint to me as your labor nurse that things are progressing just as they should. The other thing that is a great external visualization for me as your labor nurse to see is something called the purple butt line. It is exactly what it sounds like. It is a purple, darkish, or even like a shadow in someone with a darker skin tone line that comes up in between your butt cheeks, and when it gets to the very, very top of your natal cleft, that is about fully dilated. So it's almost like you are a little turkey in the oven, and we've got a little thermometer in you, and that thermometer is gonna pop up when it's time for us to have a baby. So this is actually something that has been clinically documented and witnessed, and it happens in about 70 to 80% of people giving birth. I told a provider about this the other day, and she was like, oh my gosh, that's so crazy. I'd never heard of this before, but I had my patient up in hands and knees doing her thing. I said, I think based on her purple butt line, we are seeing some progression. And wouldn't you know it, we were 9 centimeters dilated. The next few things that I want to tell you about are things that we might see, you might feel that labor is progressing to transition, and even that pushing phase where your cervix is fully dilated and it's time for you to start pushing and having a baby. The first one I saw recently in a birth where she was up on hands and knees delivering. She was reaching up over the back of the bed and holding on, and a lot of times you'll see people reach up and what they're doing is they're actually pulling their sacrum up out of the way, and we can see something called the rhombus of Michaelis, which is basically this giant bump on your lower back of your sacrum and these lower vertebrae moving out of the way if you're up on hands and knees or up in an upright birthing position to make room for your baby. When we see that, we know that baby is low in the pelvis and it is probably time to start pushing. So that is something that you might visually see, and it is the wildest thing. Some things that we also might visually see if you are on continuous fetal monitoring, sometimes what we'll see is something called an early deceleration. A lot of times you hear deceleration, that's not good, but earlies actually just tell us that we're having some head compression because your baby's super low in the pelvis, probably in the birth canal, ready to be born. Often coinciding with those early decelerations, we might see a period of time when all of a sudden your contractions just totally slow down. For patients who don't have an epidural, often they'll fall asleep in this 10 to 15 minute rest that you have once you reach fully dilated, because your body knows what's up and it knows you need a little bit of rest to get things going. So if I am watching a patient's tracing and they have an epidural and I see, oh my gosh, we now are having contractions that are way further apart, what is going on? In my brain, I'm thinking, do we need to do something to help enhance labor, or are we fully dilated? Other things that you might feel as you hit transition, which is that 8 to 10 centimeter range, is uncontrollable shakes. That's your body coursing adrenaline through your veins. That does two things. It helps you find the will to fight and push that baby out, and it also tells your baby when it comes out, hey, breathing, great thing to do. So adrenaline is going to be something that we see right at the end that gives you those shakes. It is a normal part of labor. You just got to try and ignore them. That's the best way to make them go away. There's also a pressure point on your foot that you can push that sometimes will help, as well as, this is silly, but sticking out your tongue and biting it can sometimes help with those shakes as well, because that's a really normal part of transition. Another normal part of transition is vomiting. Sometimes as your baby gets lower and it's putting pressure on your lower GI tract, and we already have delayed or slowed gastric emptying due to the labor hormones, you might throw up. Good news is vomiting does the work of 3 contractions, and I have totally seen somebody throw up and then all of a sudden be fully dilated and ready to push and have their baby. So if you're feeling shakes and nauseous and vomiting, know that it's normal. Know that that means hopefully things are progressing just as they should, and it's getting almost time to meet and greet your baby. The next sign that things are moving along and progressing is that Now you are feeling some pressure in your bottom, like you need to have a bowel movement, or pressure in your vagina, a really big heaviness there. And you don't need to poop, more than likely, you just need to have a baby. Your baby is pushing on all of those nerves with their sweet little noggin, telling you, hey, it's time to be born. With an epidural, you may feel this pressure. Often, if my patient is epiduralized and we are feeling that pressure just with contractions, I like to keep changing positions and supporting baby coming down further until they're feeling that pressure all the time and maybe more intense with each contraction. But if you don't have an epidural, you will know, oh my gosh, I need to push and poop. It's time for me to have a baby, because that baby will come down low enough and actually trigger something called the fetal ejection reflex, or the Ferguson reflex, where you are pushing involuntarily because that baby's like, I am coming out, y'all. Okay. So I hope that this video was helpful for you guys in knowing all these ways that we can ascertain that there is labor progress without checking your cervix, and also knowing all of the things that go into a cervical exam that count as labor progress more than just dilation. Because there's a lot going on, so many working pieces moving and working together to help your baby get here healthy, happy, and safely. And so listen to your body, trust that it knows what it's doing, know that progress sometimes is not perfectly linear. We're not gonna hit every single dilation on the way to fully dilated, more than likely. But sometimes we do if it's a long induction process. And just know that you are doing amazing, your baby's doing amazing, beautiful things. You have grown this baby and you are birthing them. Thank you guys so much for watching. Definitely let me know if you have any questions. Let me know what you've experienced from these signs. And until next time, bye guys.